often get questions from parents, like Andrea asked me last month, about constipation in their baby when they're starting to introduce their baby to solid foods. So I wanted to take this video to talk about what is constipation, what isn't constipation, and 4 food-related ways that might help get things moving again. And yes, this is a YouTube video on poop. What a glamorous life I lead. So, what is constipation? Constipation, well, let's back it up a moment. When you're introducing your baby to solid foods, you're changing what you're putting in one end, so of course, as it follows, what comes out the other end is going to change too. And when you're exclusively breastfeeding or formula feeding, it's common for babies to have bowel movements every day, multiple times a day. When we're introducing solid foods, you're introducing food that takes a little bit more digestion. So it's normal for bowel movements to become less frequent, perhaps even skipping some days in between. That is all normal. It's considered constipation when the stools become crumbly and dry and you can tell that your baby's having pain moving them. That's constipation. And I wish that there were some gold standard, best practice, food-related ways to help get things moving again. But unfortunately there's not. So I'm going to share with you 4 common food-related ways that do help get things moving again. The first is to reflect back to the last 48 or 72 hours and think about, did you introduce a new food? Because constipation can be a sign of food allergy or food sensitivity. If you notice that you did introduce a new food within that time period, stop offering that food and see if the constipation clears up. The second is that iron supplements can be constipating. And iron supplements, usually we're not giving supplements to our babies, but it's the type of iron that's fortified in iron-fortified foods. So things like iron-fortified baby cereal. So if you've recently increased the amount of iron-fortified foods that you're offering your baby, that might be where the constipation is coming from. So again, scale back on those foods and see if the constipation clears itself up. The third way is to offer your baby pears, apples, and or prunes, because these foods naturally contain a type of fiber that helps draw in the water and help get things bulkier and easier to pass. There's also some powders and such that do the same thing. These aren't designed for babies, so I don't recommend them. And the fourth way is water. While breastfeeding or formula feeding, you're probably meeting your baby's fluid needs, but why not introduce how to drink from a water in a cup at this time? You take advantage of this and offer your baby water in a lidless cup so that they can start learning those skills. Sure, lots is going to end up on the outside of them and not in them, but little bits of extra water may help. And if your baby's constipation doesn't start clearing up fairly soon, do be in touch with your healthcare provider. It might be time to look for a non-food related, more medical intervention to clear things up. I hope things resolve soon, and in the meantime, enjoy your family and good food.